Okay, can everyone hear me? And would love Mr. G.T. Sweeney, Dr. Shafiq Rab, and Mr. Ivan Durbach to turn on their microphones. We will try and keep this most informal. And first of all, it's an honor, Dr. Shafiq Rab, Mr. Durbach, and Mr. Sweeney, that you've given us your time. That's most important. And we will try and kind of make it, I think the viewers and the audience will gain immensely from some of your counsel and insights. So what I want to do, it's important that I want to introduce you, not as a platitude to just read out your accolades, but largely to contextualize that what you're saying, GT or Dr. Rab or Ivan, these are battle scars that you earned over the years, stripes that you have managed to collect. And what you're saying comes from a position of authority and substance. So with that, I'd like to inform all of the viewers that we have amongst us Mr. Ivan Durbach. Mr. Durbach has been a key client of GAVS Technologies and taken a leap of faith in allowing GAVS to support Bronx Care. He's been in the IT industry for over 30 years in developing, planning, managing information systems. But more important, as the CIO at Bronx Care, and Bronx Care serves one of the poorest of the congressional districts in America, he has to work on being as innovative as he can in providing healthcare to the most impecunious folks. And it's not just a luxury, but something that he takes very seriously. So he's been using technology to provide support to 2 nursing homes, 2 hospitals, several emergency centers, and they support, I repeat, they support 1 million clinical services annually to a large segment of Central and South Bronx areas. Ivan, welcome and thank you.
Thank you so much.
Mr. Sweeney, you have been again someone who has been working with some of the largest of the corporations, and I will be honest, I'm always humbled that you saw it in your heart and your people that you were engaging with GAVS and has given us some opportunity to serve you. Health First, again, I don't want to steal your thunder, is an interesting body that was created to support the denizens and the residents of the local New York, New Jersey area, where a lot of hospitals came together. But more important, you've been serving as Health First Chief Information Officer since 2014. You've been leading the Information Services Department to help transform your business and tightly integrate your information systems to further your strategic imperatives and goals. But what's interesting is that over the 20 years prior, you spent almost 6 years as a VP of Information with Cigna, and where you were responsible for managing core operations for medical insurance platforms, as well as establishing a 3-year strategy to overhaul all clinical systems. And we were talking about this prior. You've also been the Chief Operating Officer of Technology Infrastructure Services and Head of Data Center Operations within Credit Suisse. And you have had the occasion to bring all of it into a single 10,000 plus person, 3 billion organization and consolidated that within Credit Suisse. So you know what you're talking about, and you've brought a lot of your multifarious activity into healthcare. So when we discuss about disruptive technology and technology trend and how you plan to harness it for healthcare outcome, you know something about it. And Dr. Rab, I'm very partial to you because we speak a similar language coming from Bangladesh and I from the eastern part of India. And we are truly proud of what you've done. You are the EVP, Chief Digital Officer, and Systems Chief Information Officer at Wellforce, one of the more innovative companies, hospitals that have come together, and you talk about it, out of Burlington, Mass. And you lead the organization's digital transformation efforts, finding new and innovative ways of connecting consumers and caregivers. You oversee the system-wide IT organization that support care across academic, community, home health, and virtual settings. But more important, sir, you are also the chair of the College of Healthcare Information Management Executives. And we've had the occasion that we've created a healthcare technology institute in India, where a lot of your board curriculum is being supported by us in India. And you have been, again, a strategic advisor to the US Department of Health and Health Services. And I've worked collaboratively with the Centers of Medicare and Medicaid Services and the White House Office of Science and Technology Policy. Your work in the public and private and government sector have resulted in numerous industry firsts. And also you've designed a technology principle API first, AI first, and video first. And you've invented the platform using patent pending interoperable exchange between any application or data format in order to meaningfully integrate machine learning driven artificial intelligence serving contextually aware insights directly into clinical and business workflows. I say all this again, as I had said earlier, that all of you have been involved in the 360 degree of healthcare. And we are, it would be really stating the obvious that we've kind of come through an existential crisis, and healthcare has been in the fore of everything that we are about. And to that end, I'll start with you, GT, a little bit about your worldview that has defined technology, and then a bit on the trends that you see which are relevant, that's going to engender some of the business imperatives that you're pursuing. Mr. G.D. Sweeney.
Sure. Yeah, thank you. And thank you for having me. In terms of the priorities as we see it, it's all about the consumer. Healthcare is just too hard. It's too hard for consumers. Every part of the healthcare system is too hard. I work in healthcare, and if I've got to help navigate myself, or, I try to help take care of my mom who lives, 5 hours away, it's really difficult. Consumers experience healthcare through the lens of the org structure of the companies they interface with. And if you think about other industries that have been disrupted by technology, the focus is on making it easier for consumers. And so, healthcare is always going to have a degree of complexity that other industries don't. But in my view, we can't make that the excuse for not getting substantially better and making it easier. And making it easier not just for the consumer, but I think many providers, the investments in technology on the delivery system side. I think many providers today, they see themselves as doing their job in spite of the technology that they're forced to use, not enabled by the technology, right? So we're doing all of our consumer-facing capability builds using a human-centered design approach where we don't build anything without testing it with actual customers. We don't wait for them for the good ideas, but any good idea our solution gets tested with them before we build it. I think that has to apply on the provider side as well. We have to make sure the technology is consumable and that we're making it easier for those who are the front line of healthcare. I mean, at the end of the day, healthcare is all about that connection between a patient and a physician or other parts of the delivery system. So that's kind of the worldview. And it's, at Health First, we've got a unique business model. We're owned collectively by the nonprofit hospitals in New York. It's a value-based business model, and it's a value-based business model means that the incentives are aligned, but it really means that we can collaborate more effectively than others can. And so, the idea of improving the way the healthcare ecosystem collaborates in service of an improved consumer experience, that's where we're spending most of our energy right now.
That's absolutely fascinating. And I think it'll be interesting to juxtapose what you're saying with Ivan's experience in terms of supporting some of the patients that are perpetually coming into Bronx Care, and how you can weigh some of your cost challenges with the care and the disintermediation that GT has been talking about.
Yes, Sumit. So again, thank you. And we have a very, I believe, exciting and interesting environment here in the South Bronx, because we service, as you mentioned, a very poor patient population. We're largely a Medicaid hospital, a lot of charity care. We're also a patient safety net hospital in that regard. And we're, a private nonprofit in this regard. We have rather severe financial difficulties, but we decided decades ago that the way to survive and thrive was to embrace technology, be a risk taker, go out there, try new things for our patients, for our providers, whether it's bringing in telehealth, bringing in artificial intelligence, bringing in new ways of improving the physician-patient interaction, the UI, as they talk about, and also to be in the lead of taking advantage of the technology initiatives happening. You know, we're all going surely but slowly, perhaps to the cloud. Cybersecurity is a huge concern for all of us in the hospital business now. So we've done that, and we're quite proud of the fact that here, after a year and a half of, intense sessions being at the epicenter of COVID for the first few months, that we've emerged, we've survived, we're thriving, and we're looking forward to, we hope, an exciting future.
Thank you, Ivan. Thank you. Dr. Rab, you have these large, audacious ideas, and you have managed to kind of execute some of them. You've really done some interesting work in mobile, a lot of work that you're exploring in 5G. Would love to the viewers to hear about the technology trends in your view and some of the absolutely innovative models that you have of disrupting technology for the sake of technology.
So first of all, it's an honor to be in the presence of G.T. Sweeney and Ivan Durbach. Ivan Durbach is really fighting the real battle, and he's a warrior with all the necessary wound and marks. And Mr. Sweeney is a global person, so thank you for including me. It's an honor to be here, and thank you for liking me, Sumit. I think very nicely said. We're going through, I'll not take much time, but I'm going to tell you what's going on with us. We're trying to understand how we can become like an Apple iPhone or Amazon service or something like that in the world of healthcare. Healthcare is a little complex. There are 3-4 components to it. One is the consumer, that means the end user. Second is the caregiver, the people who give the care. And third is the employer, who actually are the people, staff who work. But there's a fourth person in it, and we don't talk about them. They are the payers who give the money. The healthcare of the United States is governed by how we get paid, bottom line. So they're changing from how we're getting paid from Medicare, Medicaid, from Blue Cross Blue Shield, United Healthcare, commercial payers, to a concept everybody's saying, let's pay based on outcome. Hence, when you want to get paid based on outcome, people start talking about patient experience, consumer getting it, but then comes the public health component that, hey, if you are already healthy, things will become better. Because I'm going to explain that to you, then I'll talk about technology. Here is the idea. The idea is $100. Nobody should ever use that $100. You always should stay at home. You always should be healthy. That's the idea. From birth to death, right? We give you all the care, all the, it's not going to happen that way. But if you go to ED, don't get admitted. If you get admitted, get out quick. And if you get out quick, go to nursing home, spend 3 days, but get out quick. That is known as utilization. So less the utilization, less the money spent, everybody happy. Ain't gonna happen. Why? Because we have not connected ourselves. We have not connected ourselves. We have not made good workflows for our healthcare systems. We have not connected the information like the banks do. And we are not connected with our consumers when they need the information. So hence, the speed to technology, 4 or 5 things are helping us today. 1, cloud computing, so we can compute at a higher level. Edge computing, so on a phone, so we can take it to the end. Connectivity, which is 5G, or now 4G, 5G will become better by October when the Snapdragon X65 modem comes out, which actually connects at 10 gig. And then the interoperability movement on FHIR and R4. And then the biggest thing is that the federal government has said that API needs to connect. So that connectivity together has allowed people to produce solutions. That means hospital at home, home healthcare, care advice, connectivity, taking major EHR builds to the cloud, taking the risk to bring things together. And like my friend, Mr. Durbach said, cybersecurity. So in that complex world, what we are trying to do is that appify everything based on an app, make it real time, and go to where the consumer is. That means if the consumer wants to use a phone, they can. If they want to use a video, they can. If they want to chat, they can. If they want to not talk to anybody and do it themselves, they can. But there has to be programs behind it. I'll give you 2 examples, then I'll get you back to your questions and answers. So the way the philosophy works, if I have cancer, when the person hears about cancer, they're already ready to die and they're upset. First thing is that we should have an immediate appointment. It doesn't happen. So at least you have a virtual appointment. But in the world of cancer, it's not only the disease, but you have to get your lawyers right. You have to get a state of affairs right. When you get treated, you lose your hair, you need a wig. So understanding the human being, like he said, human-centered design, that means what are the needs of human being? So we are becoming a health and a care organization, from preventative to last part in which people actually get the care. We're trying to complete the continuum of care with technology, just in time, and trying to provide all the other means to improve the access and delivery. That's what we are working on. I hope that was good enough. I don't know.
This is very, very good. And I'm going to continue this conversation. It's perfect. GT, again, your business imperatives that is coming down from your chairman at Health First again. And you've really grown since the time you've been there in 2014. What's the role of IT? And as I said again, some of the technology trends in line with what Dr. Rab kind of indicated. What are you doing to be in the forefront of that technology and kind of disintermediate some of the work that you do?
Yeah. So, in terms of priorities, so we serve the underserved of New York. We have 1.7 million members, 1.1 to 1.2 million of them are Medicaid. So we serve the underserved with the highest quality healthcare in every product that we're in. We saw more growth last year than we saw in any 3-year period previously. And we had to support that growth while all working remote without any time to kind of really intentionally plan for it. We were ready, but the move to home, like many organizations, happened in a couple of day period last March. So our priorities are to continue to support that growth. We're a nonprofit model owned by the nonprofit hospital. So margin to us flows back to the hospitals, which is a really compelling business model. And in the time where the hospitals are the heroes that led us through the COVID pandemic. And we're fortunate to count Bronx Care as one of our sponsor hospitals, and partner with them to serve that underserved population in the Bronx. In terms of priorities, it's about continuing to grow, provide more care to more underserved populations. It's about driving that growth while continuing to improve quality. That continuing to improve quality is increasingly focused on, Dr. Rob referred to the way, alluded to the way that the delivery system collaborates. There's no B2B ecosystem in healthcare that's anywhere near modern. It's the same way it was 30 years ago with fax machines and email attachments and phone calls. You think about a B2B ecosystem in financial services, a very different thing. So we're very committed to standards like FHIR and the interoperability mandates from the government. I believe that is progressing this focus on the consumer, but there has to be more modern ways to collaborate amongst the entire delivery system. And we see that as primary care, specialty care, devices, home healthcare workers, unpaid caregivers. My effort to look after my mom, it'd be great if that was easier. And it also includes the community resources that address social determinant barriers that many of our members see. It's hard to think about a member addressing their preventative care, their annual screenings when they don't have, housing security or food security, or if they have legal issues that they're dealing with. And so oftentimes that's the barrier to healthy outcomes for our members. So we're addressing all of those things to get better outcomes for our current members, to provide better partnership to the hospitals and the other parts of the delivery system in the areas that we serve.
No, that's very interesting. And since you kind of alluded to Ivan, again, real work that you're doing, how is AI or this whole aspect of people centricity, location independence in terms of distributed cloud or cybersecurity mesh or resilient delivery using AI engineering or hyper automation, is that at all relevant to a large hospital in Bronx?
Well, we have been using some AI, and it's taking off like crazy in three major areas I see. One is an area that's been working on for many years, which is decision support. So a physician is treating a patient and is making a diagnosis, and the computer comes back and says, hey, there may be another diagnosis, comorbidity may be relevant. So alerts. We actually have 1,100 decision support alerts ready to fire at our doctors and nurses every moment. They know. A second area that's becoming very big is in terms of predictive analytics, and GT and Rob are very familiar with that. So we're anticipating that a particular patient Ivan, for example, based on history, the computer predicts patient Ivan may come into the hospital X times during the next year and spend $80,000. Well, pay attention to that, because anything you can do to reduce that can not only help the patient, but reduce costs, you know. And third, which I think is a very exciting area, is the whole interface between clinician and patient. I mean, today still, we at Bronx Care, we treat on average 4,560 patients a day. In many of those cases, the physician is tied up with entering data into the computer. And so AI, one aspect of AI, one example out of many, is this conversational AI. Why does the physician have to spend any time on the computer? Why doesn't she spend all the time looking at the patient, and the computer can take the voices and figure it out? So these are some aspects of AI that have become very important to all of us.
Very nice. We have 5 minutes for the panel. Bring it home for us, Dr. Rab, in your big picture, most disruptive approach as to where do you see the hospital of the future?
I think all the care, most of the care will be at home, and most of the care will be delivered in a Uber-like fashion. That means doctors will opt, pharmacists will opt, nurses will opt. You can have anybody who wants to take care of the patient, they can, but that's futuristic. But the most near term is that we have to go to our communities and we have to start working from there backwards in. Otherwise, there will be no savings, and we have to change our payment reform model also. Medicaid pays well, but not as well as Medicare and not as well as commercial payer. We still pay the highest for spinal surgery. We still pay the highest for cardiac surgery. Preventative care and preventative work, and also taking care of other social determinants of health, has to be taken care of. Otherwise, healthcare will not become better. It will not. It'll still be a burden. So for that purpose, technology is the only solution. App and appification and B2B connection between the patient and the doctor, doctor to doctor, doctor to other consultant, that ecosystem has to be built. And it is possible now before it was not. So you will see those apps coming in, you will see those connectivity coming in. And as Ivan said, that alerts people are talking about, they will become more precise. That means healthcare will become more personal, it will become more precision medicine for each individual, and you will see that cooperation coming out. And the data that comes out of it, that'll be sold bilaterally in the market. You will see there will be a new market for that.
Okay, thank you so very much. We've got Bob Crone from ISG again. Bob is actually a doyen in the healthcare field, more from an analyst and advisory role. So Bob, over to you. Questions of the esteemed panelists, Bob.
Well, thank you so much, Sumit, and it was a very enjoyable session. Looking forward to getting some questions from our audience today. So, first question has been forwarded to me. Investments in healthcare technology and the factors that influence those decisions.
You broke off for a little while. You could have turned emotional. So would you repeat that again?
Yeah, sorry, I have a thunderstorm that's just hit my house. How do you approach Capex, Opex, investments in healthcare technology, and the factors that influence those decisions?
GT, you want to take that, please? Capex, Opex.
Sure. Yeah, I mean, the Capex and Opex dynamics have been changed by the cloud and by the opportunity 2 years ago to begin capitalizing cloud-related investments on the labor side. So those dynamics are always important. I think there's really two dimensions. Like we have to make it work within the premium envelope and within the administrative expense envelope. So we are focused on ensuring that we are continuously delivering economies of scale, making it cheaper to run our core business so that we can invest more in these consumer-facing capabilities. And so it's really that tension. If the board didn't want to talk to me about digital investments until we got our expense situation under control, until we could demonstrate growing economies of scale. But once we were able to demonstrate that with our technology investments aligned with strong business leadership, the conversation turns to investment to drive growth and investment to drive outcomes defined as clinical quality, as well as retention and then more financial returns back to the hospitals.
Opex, Capex are gone. It doesn't work anymore. There's only one thing that works: business investment. Digital transformation has to be part of the business transformation. That's pretty much it. The moment you do that, everything's approved.
Interesting.
Thank you
And
both.
If I could just add a simple note, at Bronx Care, we're investing a lot in healthcare technology, especially to make our clinicians more efficient. Because they are suffering. You heard about physician burnout. You see all these difficulties now. So we're investing money in various aspects of that. One of the areas that most people don't think about is in terms of infrastructure. We're using AI today in order to predict when servers and switches might start reaching end of life and go down. So we get there ahead of time and proactively, because nothing is worse to a clinician than having downtime. Thank you.
Thank you.
Thank you, Ivan. Second question, are you leveraging remote health monitoring?
Yes, we are. We are not only remote health, we are, like you have an EICU, we have those technologies in which not only we have alerts on it, we are doing that on a daily basis, and we in fact intend to expand on that.
And we at Bronx Care are launching now a program we called RPM, Remote Patient Monitoring. We're putting 2,300 blood pressure monitors out into our patients' homes and monitoring them constantly in order to better predict and better get the patients in to avoid ED and hospitalizations and save money and most importantly, provide better patient care.
And I see 5G as really driving that kind of inflection point where the Internet of Things in healthcare becomes a real factor. I do think it's important as it becomes that real factor that it doesn't, that we kind of cohesively knit it into the rest of the delivery system, and that we don't make the consumer be the one who intermediates between a device and a primary care physician or a hospital that they were recently discharged from. We have to make it easier for consumers as this investment in a kind of B2B ecosystem.
Good. I think, Bob, that's the time we have. First of all, again, Ivan, GT, Dr. Shafiq Rab, thank you very much on behalf of GALS Technologies and on behalf of ISG. We thank you for your time, and we in some way know we are in good hands with people like you running healthcare technology. Thank you again.
Thank you.
Thank you, Sumit.
Thank you.